About 18 months ago, a group of respiratory physicians and managers from the two big teaching hospitals in Manchester got together over dinner and had a conversation about how we could improve things for our patients. To give you some background, Manchester has Central Manchester Foundation Trust, which is situated in the middle of the city, and University Hospital of South Manchester, which is 7 miles further south. And there is a large population of patients, around 300,000, who live in between the two trusts. And historically, those services have been developed independently. They're commissioned separately by the Central and South CCGs. And access to those services, particularly in the community, are very much dependent on patient postcode and where they live. And this creates inequity in the system, and different patients may get different standards of care depending on where they live. Our overall mission with this project is to really understand what's important to patients and carers and to bring services together regardless of whether it's primary, secondary, third sector organisations, to try and achieve those outcomes for patients. What this means practically on the ground is both vertical integration between secondary care and primary care, but also horizontal integration with Central Manchester Hospital Trust and merging our frontline teams and ensuring we're working in the same way.
We've tried to integrate the teams across the two trusts by forming a series of joint meetings. These have progressed on to educational meetings and then on to meetings that have looked at the operating procedures within the two trusts to try and standardise them. The teams have responded well to the integration because they've come with a very open approach to what they're doing. They form personal relationships across the two different trusts. Therefore, we've overcome the challenges that have been set out.
The Integrated Steering Group has developed a mission and vision and values document together, and we have clearly set out our objectives for the project. We're working on the principle of co-design, which involves bringing people together from different parts of the system, including patients and carers, and having those discussions about what do we do well, what could we do better, what does perfect look like. And having the richness of those perspectives has been really important and has directly influenced the services that we are now developing.
The project has tried to use the concept of co-design to look at pathways for patients. That is bringing all the stakeholders, as it were, together and asking for their contributions. I think that's worked quite well. I sometimes think, though, that role reversal might be considered. So if we looked at staff putting themselves into a position of being patients, what would they want, and patients putting themselves into the position of staff and understanding what they think might be a priority for the staff, might help us to move things forward.
The main benefit from the Future Hospital project for clinicians within primary care, I feel, has been the support that they give us. Over the years, respiratory care has been moved from secondary care into primary care, so we're now diagnosing and managing patients throughout the whole disease process. So as clinicians, we've had to become more skilled in being able to deliver this care. Through the Future Hospital projects, we've actually been given that support in order to provide that care. The Future Hospital project is different to previous projects. In previous projects, the design of the project has been made by senior managers, senior clinicians, and when it's been implemented, it's not always been fit for practice, and the support for clinicians hasn't already been in place. With the Future Hospital projects, because all the stakeholders get around a table at all stages of the development of the project, when it comes to be going live, then all the problems tend to have been ironed out, and the project can actually run and hopefully be very, very successful.
There's a number of major changes going on in Manchester at the moment. There's devolution, bringing more power to decision makers locally. There's the integration of services across the hospital sector and community services. And finally, there's the merger between University Hospital South Manchester and Central Manchester to create a new foundation trust for the city. I think the work we're involved here is absolutely vital. It's very much about looking at a different way of providing hospital services that's actually fit for the 21st century. And at the heart of it, I think, is about breaking down the sort of artificial barriers that sometimes have existed between hospital services and community services. and really on the basis of that, really sharing that learning with other partners across the NHS and beyond.
The future of the project is exciting. I think the work that's going on between Central and South Manchester is only the beginning, and there is a lot of opportunity to start working with our partners wider in the city, with North Manchester, Stockport, Trafford, to try and ensure that the respiratory care we're providing is not just high quality, but consistent and coordinated across the whole city.